Hello, my name is Daniel Stillwell, and I am the editor for the IFTA e-newsletter. We talk to researchers and writers and professionals throughout the world about their different clinical work. And today we have with us a wonderful guest, Dr. Pauline Boss, Emeritus Professor at the University of Minnesota. Welcome.
Thank you. It's my pleasure.
I wanted to start off with a question that I ask everybody because we have professionals working all over the world. What kind of mental health practitioner do you identify as or with in your work over the years?
Oh, that's very easy. I always identified as a family therapist, a marriage and family therapist, and was proud to be that. I was practicing as a family therapist for 40 years. I no longer do now, but that is really my forte. I love the study of the family and the therapy with the family.
And you've also been a professor and educator and researcher as well, right? In this field?
Yes, again, focusing on the family. I should clarify though that while I love and focus on the family, I also pay attention to individuals within the family. So it's a both and way to study, but in a sense, I'm a systems thinker always. And that's really the basis of my work as a researcher and my past work as a therapist.
Well, as systemic people, we have to think about all the layers. That's wonderful.
Right.
You are most famous for your idea of ambiguous loss. And there's a quote that you have that says, "I intentionally hold the opposing ideas of absence and presence because I have learned that most relationships are indeed both." And I think that is often so important and so elegant, but also so difficult for so many people to wrestle with as they experience some type of connection and disconnection simultaneously with some event or some person in their life. Can you tell us a little bit about the theory, maybe how it developed or how it's been used throughout the years?
Well, the theory of ambiguous loss focuses on two types of loss: physical ambiguous loss is where the person's body is missing. You don't know if they're dead or alive. And psychological ambiguous loss is when the person is there with you, but their mind and memory are going or gone. And so they may no longer know who you are. That has now gone around the world and increased to include community level analysis and community level interventions. And that the ambiguity is the culprit. And so the symptoms are not necessarily because the person or the family is weak. It is because the surrounding context and environment is what's causing the pathology. So let's say with COVID now, the pandemic was the problem, not the people experiencing it, even though we had symptoms of anxiety and sadness, but those were normal symptoms in response to an abnormal situation. So the systems thinking has just gotten larger. Yes.
Yes, I know that when you're working with people who are have absent fathers, or who are partnered with someone who may have been killed in action, those types of moments were the more obvious ones. But it seems that the idea really strikes a chord to even how we understand grief itself.
Yes, and in almost all theories of grief, there is a stipulation that you have to admit that the loss is permanent. Well, people with an ambiguous loss can't do that.
Right.
You can't even expect them to do it. In other words, it's not their pathology that they can't do it, it's reality. And so instead, I promote both and thinking in my writings and previously in my therapy. And that would mean that you teach the people with somebody who's missing, either psychologically or physically. For example, with a dementia patient, she is both here and gone. And so that's as close to the truth as you can get about that ambiguous reality. And with somebody who's physically missing, you can say, he's probably dead and maybe not. And if you leave that kind of both and thinking with the people, you will see their stress levels go down. They do not want absolute thinking by saying he's dead or he's absolutely alive. They know neither of those is really true.
Hmm.
There's no evidence. So they actually like both and thinking. And it's not dialectical thinking, because that would mean there's a synthesis, after saying she's here and gone, because there's no synthesis.
Hmm.
And so it's not quite dialectical thinking, but it is both and thinking, and holding two opposing ideas in your mind at the same time is a good idea for ambiguous loss. It's not a good idea for your banker, of course.
Sure, sure. Well, and even the sense of paradox that comes with that. People are so scared so often when the idea of paradox engages, because they think they want certainty, but what they actually want is security. And I like how your work does a good job of helping people not need final answers to every question.
Yes. And with the humanitarian work that I consult with and write about, many times people in foreign countries, from war, from terror, even here with kidnappers, the family may not find the body. They may never have certainty. And so we need to help the family live with not knowing, live with the unanswered questions. And as far as I know, the only model is the ambiguous loss model for that. And I wish we didn't need it, but we do. Yeah.
Well, thank you so much for joining us and talking about this. If other people want to be involved or learn more about this, I know that your family social science community has an ambiguous loss certificate that people could actually go and learn more about this and get some CEUs for their training if they needed it.
It's the University of Minnesota.
Okay.
So all they need to do is Google www.ambiguousloss.com, and it'll have that course, the source for that course, and all the writings I have done in the past, plus all the books I have had. So it's the main source of information.
And I do believe that you have another book that came out just a few months ago that you'd like to tell us about it as well.
Well, I wrote this book not in an academic way. And in fact, I wrote it for ordinary people and believe that therapists can also read it because they're busy and they need a fast read. It is not a therapy book, but I hope it's therapeutic to the many people who lost so much during these going on 3 years of pandemic. And so it's primarily written from a stress base to tell people how to cope with the stressors that they've had, ambiguous and clear, and the changes that are coming, and the new problems that society has had, including racism and climate change. I've also referred to them as ambiguous losses, and the reader can see if they agree with me or not. But indeed, they are stressors in our environment, and they will affect our own behaviors.
Absolutely. The name of the book is The Myth of Closure.
Yes.
We are going to make a link of it in the e-newsletter, but you can find it wherever you buy books. Pauline, thank you so much. I know that we won't be able to see you at Puerto Rico in a couple of weeks, but we hope to see you next year in Spain.
Yes, I'll be doing
exciting.
a plenary.
Yes.
I believe. Yes. Thank you.
All right. Well, thank you very much for watching, and we'll see you in a few months for the next round.